Welcome back. Well, they say they offer state-of-the-art treatments for some very serious conditions.
Charlene recently visited UF Health Proton Therapy Institute. Take a look.
We all know how scary getting a cancer diagnosis can be, whether it's us or someone we love, but luckily there are new and progressive treatments out there with limited side effects. So we are thrilled to be joined today by Dr. Bradford Hoppy. He is a radiation oncologist at UF Health Proton Therapy Institute. Good to see you again.
Thank you for having me.
So today we're going to focus on Hodgkin lymphoma. So walk us through a little bit what that is and where that starts in the body.
Sure. So lymphoma is a cancer of the lymphatic system. Your lymphatic system is all the network of lymph nodes that surround your blood vessels and essentially filter your blood to look for infections. And so that's why you get a swollen lymph node when you get sick. But you can actually get a cancer that starts in one of these lymph nodes, and that's what a lymphoma is. Now, Hodgkin lymphoma is a type of lymphoma that's kind of unique because it is a very common cancer that we see in younger individuals, sort of between the ages of 15 to 40.
So let's talk about how you treat that, because that sounds like that could be a very scary diagnosis to get at such a young age.
Yeah, so Hodgkin lymphoma is generally treated with a combination of chemotherapy and radiation. Success rates have been very good with about 85% cure rates, and because it affects young patients, we have a lot of 20, 30, 40-year survivors. Now the problem that we've encountered is that patients that live this long do develop some long-term side effects from their treatment, including subsequent radiation-related cancers, as well as cardiac or heart problems that hurt them years later.
So that's why it's so important to be able to use the more progressive techniques so that it does limit the side effects and the ultimate damage that can occur from the treatment itself.
Exactly, and so what's happened, unfortunately, is that some medical oncologists have not been having patients get radiation, and that's compromised the cure rate. And what we've been doing as radiation oncologists is limiting the radiation dose that we use that reduces the risk of these long-term side effects. And what we're doing here uniquely is using proton therapy for our Hodgkin lymphoma patients.
And how does that set it apart from traditional radiation treatment? Because you don't not want to get the treatment, but you also don't want to get the side effects that could damage you for the rest of your life.
Exactly. So regular radiation uses X-rays that just go right through you. And so a lot of patients with Hodgkin lymphoma have disease in the middle of their chest. So you can imagine we're going through breast tissue, we're going through the heart, we're going through lungs, and potentially causing long-term problems in those areas. What protons do is that because they have both mass and charge, they'll go a certain distance and then stop. So we don't get that exit dose, which allows us to spare the breast tissue, so no increased risk in breast cancers, spare the heart, so we don't have increased risk of heart complications.
So let's talk about, though, the success rate, because obviously you want to limit the side effects, but you want to survive the ordeal, period. So are you seeing a difference when you use the proton therapy versus traditional treatments?
Well, so we've been very pleased. We did a collaborative study both with the University of Florida and the University of Pennsylvania, as well as other proton centers in the country, and we pulled all of our patients together, and we found that actually our cure rates are very good, 93% cure rates in our Hodgkin lymphoma patients using chemotherapy followed by proton therapy, and we haven't seen any unexpected side effects.
That's the number I want to hear. If I'm coming in to talk to you and I ask, I want to hear 93%. So if I am coming to you and I received this diagnosis, is there a particular type of cancer or age group that qualifies to be able to be eligible for proton therapy?
Sure. So basically anyone where they're planning to use radiation can benefit from the proton therapy. However, because the benefits really are for patients who are living 20, 30, 40 years in the future, we see a bigger benefit for the younger patients, as well as for those patients where the disease is located in the middle of the chest or in the abdomen, where we can really spare them from the side effects of the treatment.
And what would you say to someone if they've just received this kind of diagnosis? Come speak to you, find out more about this process?
Yes, no, I think both speaking to your medical oncologist, but then also coming for a second opinion is always very wise. You want to speak with the radiation oncologist, not just the medical oncologist.
Dr. Hobby, thank you so much for being here and inviting us over, and I know taking time out of your busy day. You always provide such great information, and of course we would like to thank UF Health Proton Therapy Institute for sponsoring this segment, bringing us all this great information. And for more information, if you'd like to come and get that second opinion or even that first opinion, you can visit floridaproton.org to learn more about this process, or give them a call at 904-588-1436.